3, 2, 1. Good morning. My name is Muhammad Janjun Sarif, secondary medicine student of Southwestern University, Finland. Could you please state your name and your birthday, please, for me?
My name is Muhammad Dawid Sarif. My birth date is September 28, 2006.
Alright. So, for today, I will be assessing your respiratory system or your organs, specifically your lungs, as well as your thorax, and then your breathing. So basically, I will be checking for any abnormalities, and if so, I will be referring you to for any further test that is needed. Is that okay with you?
Yes.
Alright, do you have any questions before we start?
No.
Alright, so firstly, by sanitizing my hands, and then by positioning you in a most comfortable position. So you're already been sitting, so that's comfortable position. And then please, could you please turn your back? Turn your back, and then I will assess for your posterior chest. So for your posterior chest, in order for me to assess it properly, could you please remove your top? Now, what I will be assessing is that for any deformities and then any muscle retraction, abnormal muscle retraction, and then impaired muscle movements, as well as for the shape and then the color. So as we can see here, the color is fairly distributed. The shape, there is no obvious deformities, and then so far there is no masses, inflammation, or lumps per inspection. So upon inspection, I will now be proceeding to palpation. So for the palpation, what I will be assessing with the use of my index finger and then my middle finger, slightly pressing or palpating towards the patient's posterior chest. So basically, first is to ask the patient to if there is any pain prior to consultation. So do you feel any pain on this area, specifically your posterior chest, before going here?
No.
None. So if the patient answers none, so we got to check randomly all over the chest, posterior chest area. So what we do, again of course, for palpation. So randomly over the chest. So I will be asking the patient if there is pain. Is this painful? Is there any pain?
No.
So far, is there any pain?
No.
Alright. So basically, what we are trying to find is any, aside from the palpable crepitus, we're also looking for tenderness, any obvious tenderness that the patient will be describing. So we are also assessing for any skin deformities, such as masses, inflammation, or any bruises, or any pain at all. And now, after that, after the palpation, for the first palpation, I will now be proceeding to the testing the chest expansion. So to test for the chest expansion, at the 10th rib, with the use of my thumb, at the 10th rib, I will place them correspondingly on each chest, and then correspondingly again, the index finger as well as the other parts of the fingers will be touching the lateral rib cages. So I will be locating properly the diaphragm posteriorly. And then I will be forming medially a skin fold, and then I will be asking the patient to please inhale deeply. Alright, again. Okay, so what I'm trying to assess here is the good excursion or the chest expansion bilaterally, symmetrically. So I'm trying to locate if any problem or deformities on each or both the chest. So in this case, it is normal, it is bilaterally and then symmetrically normal. So both chests are expanding well. So after testing for the chest expansion, I will now be proceeding to the ladder-like, in which I will be palpating again with the use of my ball of my ulnar. So with the use of a ball of ulnar, there is a pattern here, unlike the ladder-like for the auscultation. In here, I will be just using this and not this, not the fingertips. So I will ask the patient to please say 99 every time I get to touch your skin.
99,
Okay?
99,
Again,
99,
again,
99,
again,
99,
again,
99,
again,
99.
again. So what I'm trying to assess here is the tactile fremitus. So for the tactile fremitus, I'm trying to rule out any crepitus here along the breathing, and then I'm very cautious of not touching with the use of my hands, not touching the patient's posterior chest skin, so that I could not prevent any vibrations that is highly needed in this procedure. So in a ladder like, so again, 1, 2, 3, and then at sides, 4. So while the patient is saying 99, I can feel the vibration is equally distributed and not impinged or occluded by any air or fluid field or mass field particles in the chest. So after that, I will now be proceeding to the second to the last sub procedure of this type of assessment, which is the percussion. Now for the percussion, again still using the ladder-like, but more specifically on the 7 ladder-like. So I will be using the middle and then the index finger with the use of my dominant hand as the opposite, tapping my finger and middle finger touching the patient's skin. So in here we have 7 counting of ladder-like. So it's like this one. It's just, it could be the only one, then 1, 1, 2, the other side, 2, 3, the other side, 3, 4, the other side, 4, the other side, 5, the other side, 5, and then to the side, 6, and then 6, 7, and then at the sides or lateral, 7. So I'm also trying to locate any abnormalities such as air-filled or fluid-filled particles on the patient's posterior. Now, on the same manner that we've used a ladder-like form, I will also be using it to palpate, to auscultate any sounds. Now, speaking of sounds, during the percussion, what I'm trying to find also on the 7, on the ladder-like 7, is for any flatness, any dullness, any resonance or hyperresonance, and then tympanic sounds which can be present or cannot be present at all in the patient. So those are the sounds I'm trying to look for in percussion. So this time, with the use of a diaphragm of the stethoscope, I will be auscultating the 7 areas on each side of the posterior chest. Okay? So please, could you please cough for me? Okay, very good. So I'm trying to elicit any atelectasis or any mucus that has lodged in the patient's airway. So to avoid false reading. Okay, again. 1, 2, 3, 4, 5, and then 6, then 6, 7, then 7. So what I'm trying to listen here is for the breath sounds. I'm trying to locate the breath sounds which can be varied into, first is the vesicular, that is very normal. and then the bronchovesicular, also normal, the bronchial, and the tracheal. So those are the normal. But aside from that, abnormally, there can be an added sounds or the adventitious sounds, such as the rails, the crackles, and then the ronchi or the wheezes. Now, aside from those adventitious sound, I can also be locating with the use of a transmitted sounds by identifying the the bronchophony, and then the echophony, and then the pectorology. So in that case, I can use either those ladder-like, and then making the patient state the words E or 99 or 1, 2, 3. So for example, on the same manner, if I got to hear any abnormal sounds or adventitious sounds or added sounds, I got to instruct the patient to locate it through through speaking the words of 99 on that specific area. So that is all for the posterior chest wall assessment. Alright, so after checking your posterior chest, I will now be checking your anterior chest. Anyway, there's a small difference between the two. In anterior chest, what I've applied in posterior chest, I will be applying again to you. So I will also be inspecting for any skin abnormalities, and then for any chest impairment, chest movement impairment, and then muscle retractions. Now after that, I will also be palpating for any tenderness, and then for any palpable crepitus, and then for any skin abnormalities, including inflammations and any scars, and then masses. Now after that, with the chest expansion, same what I've done with the posterior. So same. After that, I will also be checking for the tactile fremitus. So for the tactile fremitus, I will be again pointing with the use of my ulnar pulse, and then in a ladder-like also. And then I will be asking you to say 99 for every touch. I will be palpating towards your anterior chest. Now after that is for the percussion. So for the percussion again, I will be using this, the middle finger, and then ladder-like, and then with my dominant hand, and then ruling out any flatness, dullness, resonance, hyperresonance, and then tympanic. And then finally, for the auscultation, with the use of a stethoscope, and then a diaphragm, in the same manner, ladder-like, but -1. Instead, at the posterior is 7. This time, it's only 6. So I will also be assessing for it in ladder-like motions after you have coughed for me, like the posterior one. If I have detected any abnormalities aside from vesicular, bronchovesicular, bronchial, tracheal, if I have detected any crackles, wheezes, ronchi, or rails, I will have you to lead to have a transmittal sounds, and then I can also assess you for your egophony, bronchophony, and then whispered pectorology, same as your posterior. So that's it, and thank you. Alright, so that's it for your assessment of your respiratory, specifically your posterior, your back, and then anterior, and your front chest wall. Now, you can please pair your cap, and then so far your findings are normal. So do you have any questions?
No.
None. So thank you very much once again for participating in this in today's procedure. Thank you very much.